Chinese Medicine, History and Practice. Introduction to Chinese Medicine. Chinese medicine is a system of healthcare that relies on the understanding of the body as a whole. It has evolved over the last 3,000 years as a highly sophisticated design of practices to treat illness and disease. The main goal in Chinese medicine is to maintain balance through health and well-being. These practices include diet and food therapy, herbal remedies, acupuncture, as well as both moving and static exercises known as Tai Chi and Qigong. Although this approach may appear to address different parts of medicine, they all share the same underlying set of influences on the nature of the human body and its place in its environment and the universe. Chinese Medicine Historical Overview. There is evidence of a sophisticated medical system dating back to the Shang Dynasty, around 1000 BC. The Yellow Emperor's Inner Classic of Medicine was written by the 1st century AD. It is the most important classic of Chinese medicine and is a compilation over several centuries of various authors and health practices. Many of the practices of Chinese medicine come from observing the movements of the natural world. The movement of the sun and the moon, the seasons, and even the actions of animals are part of the basis of this approach to health. Acupuncture, herbal medicine, and massage developed over time as the effects seen after treatment and the benefits of health in the body show this influence specific internal and external ailments. Chinese medicine in modern times. The Western influence on China caused a retreat from the traditional forms of medicine within the country. In 1949, the communist power had a decision to make to discard 3,000 years of medicine. By 1954, the government realized the benefit of Chinese medicine and began incorporating Western medicine into its protocols as a parallel to developing modern practices in its treatment of disease. Today, Chinese medicine and its effect on the human body are studied under the same rigorous laboratory standards as Western medicine. The efficacy and principles of 3,000 years of medicine has stood the test of time. Chinese medicine versus Western medicine. The worldview that Chinese medicine depends on is based on an understanding of Taoism and its principles that everything is interdependent and mutually interactive. All things are analyzed and interpreted with reference to the whole. Western medicine bases its interpretation of the body to be broken down into parts. In order to interpret a patient's difficulties in Chinese medicine in this overall paradigm, physical symptoms, emotional reactions, and spiritual beliefs are set along environmental and social factors to explain the pathway the individual traveled to lead to a disharmony in their health. In Western medicine, this idea is downplayed to look for one cause for each disease. The treatment to reestablish balance will also follow along a pathway to restore the patient's mind, body, and spirit. These are manifestations of the same life force and cannot be separated. Western medicine practice is to fix the one disease and the whole patient is better. The Tao in Chinese medicine. Applying the principles of Taoism as at the root of Chinese medicine. By using the Tao as a barometer of balance, the interactions of everyday living and staying healthy become as natural as breathing, eating healthy, and exercise. This is a tie into mind-body medicine, popular today. The ancient practices of Qigong, Tai Chi, Meditation and diet are constructed in such a way to support the movement of the body and restore the mind and spirit to return to a more whole health way of life. The Tao must polarize to manifest its power into the energy of form, known as yin, and function, known as yang. These practices are designed to bring the inside and the outside of the body into complete harmony with its environment and nature. The two poles, yin and yang. The most pervasive force in the universe is polarity. It is the principle that provides a dynamic movement that allows all things to manifest. The physical world and the material body cannot exist without it. Energy could not function and take form to allow the rhythmic cycles of nature without polar fields. Polarity, known as the great principle of yin and yang. From microscopic to microscopic, this applies to every process and phenomena in the universe. All transformations, all movements of energy exist on a cyclic rather than a linear pathway of change. The great principle of yin and yang. The first medical treatise, called the Yellow Emperor's Classic of Internal Medicine, was written over 2,000 years ago and is based on the principles of yin and yang. Developed as a way to explain natural phenomena that had been attributed to spirits and demons, it is the first example of rational scientific principles replacing superstitious belief. The natural law of complementary polarity, the fact that all phenomena in nature occur in opposite pairs. Life and death, day and night, growth and decay, the cycles of seasons and weather. The principles of yin and yang. The first written recording is in the I Ching, known as the Book of Change. The character for yin means shady or dark side of the hill. The character for yang means sunny or bright side of the hill. As the earth rotates, there is a cyclic interchange between yin and yang that allows for one to become the other in an endless interplay of energy. This polarity gives birth, transformation, and death to all things. The principles of yin and yang are displayed in all aspects of Chinese culture and life, from medicine to diet, architecture, and art. In modern times, the polarity of yin and yang can be seen in the binary system, in aerodynamics, and in the flux of quantum physics. Yin and yang are complementary. Yin and yang are not two opposite energies, but two complementary poles of the same energy. They are not static concepts, but two phases of various states of cyclic change. This is similar to the positive and negative poles of a battery or a magnetic field. These dynamic processes are seen as a necessary interplay between the phenomena in our everyday world. Ascending and descending. Active and passive. Expansion and contraction. Male and female, hot and cold, night and day. Yin and yang are continuous. As yin turns into yang and vice versa, energy will search for a complementary opposite that will provide the most stable balance relative to itself. In breathing, inhalation is the yin phase. Take a deep breath. This concentrates air inward. Exhalation is the yang phase. Release the breath. This allows for breath to expand outwards. In the nervous system, yang is the sympathetic nervous system. It is active, ready to put the body into action at a moment's notice and put the yin functions on hold. Yin is the parasympathetic nervous system. This conserves energy, calms the body, is put into form as the body is at rest and still. Yin within yang, yang within yin. As can be seen by this diagram, yang is positive, sun, light, heaven, active, fire, above, heat, and generation. These attributes are all contributed to the energetic of yang. Yin is negative, moon, dark, earth, passive, water, below, cold, and growth. These attributes energetically respond to yin. Yin and yang dynamics. Yin and yang are not fixed qualities, but rather measures of relative polarity and degrees of activity. Energy that is too yin or too yang leads the body out of balance. If the body is too yin, it is weak, it is cold, and it can be dark. Energy that is too yang is too strong, too hot, or too light. The reference point is the individual and their condition between health and disease, and that relationship to their own optimum point of balance. An example is a person from the tropics living in the Arctic. The weather is colder than they're used to. This will cause them to become weak, and also the darkness that is in a northern climate as opposed to where they're living in the tropics, and how they actually get energy from the sun as a healing process. Yin and yang in equilibrium. When yin or yang reaches its most extreme phase, it will transform into the other pole. This creates balance in relation to each issue of health. For example, when a fever, known as yang, gets too hot, the body will begin to sweat, known as yin, to release excess heat from the body to establish equilibrium and homeostasis. When the body gets too cold, it will shiver to create muscle contractions that will eventually create heat to warm. When the cycle of transformation is disrupted and we are unable to establish a relative balance, abnormal conditions result from an extreme degree of one or the other, too much yin or too much yang, and out of balance. This will cause fevers, too much yang, indigestion, stagnation of yin or yang, constipation, too much yin, or diarrhea, too much yang. The 5 elements in Chinese medicine. The cyclic changes of nature which regulate life on earth represent the processes in which yin and yang manifest as the 5 elemental energies. These 5 energies are embodied in the seasonal changes, in growth and decay, in flavors, sounds, and human physiology. The focus is on the energy and how it transforms in our day-to-day living. Winter turns into spring, spring turns into summer. The transmutation of the energies with which they correlate is symbolized in each element. The metaphor of the seed, yin, going into a plant, yang, and then dying back to earth, yin, is an example of this endless dynamic interchange. 5 elemental energies. By observing certain discernible functions and characteristics in the environment, the 5 elemental energies emerge from various processes in nature. Both yin and yang aspects are shown in the basic principle of mutually interactive duality in all things. The human body and the natural world have corresponding features related to each element. For example, heat and the heart are related to fire. Cold in the kidneys are related to water. The 5 elemental energies. The system of polar opposites, yin and yang, and cyclic energy transformations, the 5 elemental energies, encompass all aspects of life, from organs and their functions to the diagnosis and therapy of physiology and pathology. The relationship between the body and its environment is inseparable in Chinese medicine. Each element or phase is related to a yin organ, a yang organ, a sense organ, a tissue, an emotion, and a season. This allows the natural world to be seen and experienced in the body, mind, and spirit. This is seen in the dynamic system of matter's transformation from decline and decay to rebirth and growth. The 5 elements in physiology. The foundation of traditional Chinese medicine and physiology are based on the interaction of yin and yang and the 5 energetic elements. The interdependent relationships between the human body and the natural environment may be understood by applying this practical knowledge. It is a study of the function of exchange between vital organs. There are 2 principles that govern these vital organs and regulate their functional relationship. 1. All major organs are paired according to their functions as yin or yang. Yin organs are solid and are used to collect and store, such as the kidneys and the liver. Yang organs are hollow and are used to move and transform, much like the large intestine and the stomach. Each pair of organs is governed by one of the 5 elements, or phases. Fire controls the heart, water controls the kidneys. This chart shows the 5 elemental energies: wood, fire, earth, metal, and water. As you can see, the relationship of the 5 energetic elements and the seasons. Wood is spring, fire is summer, earth is late summer, metal is fall, and water is winter. This in turn has a relationship to the yin and yang and the 5 energetic elements and the organs. Wood, the yin organ, is the liver. The yang organ is the gallbladder. In fire, the yin organ is the heart, and the yang organ is the small intestine. In earth, the yin organ is the spleen, the yang organ is the stomach. In metal, the yin organ is the lung, and the yang organ is the large intestine. In water, the yin organ is the kidney, and the yang organ is the bladder. If you remember that the yin organs store and are solid, and the yang organs move and transport, so that the liver is solid and the gallbladder is open and hollow. In fire, the heart is solid, the small intestine is allowed to move and transform. In earth, the spleen is solid, the stomach is open and able to transform. In metal, the lungs are looking at as being solid, and the large intestine as hollow. In water, the kidney is solid, and the bladder is hollow. There's also a relationship of the 5 energetic elements in the body tissues. For wood, it is the sinews and tendons. For fire, it is the vessels and the movement of blood. In earth, it is the muscles. In metal, it is the skin, much like the lungs or epithelial tissue turned inside out to form your skin. And in water, relates to the bones. The 5 elemental energies and pathology. The Chinese system of health takes into account not only the effects of toxins, microbes, bacteria, etc., but also looks at the effects of the emotions, the weather, and cycles of the human brain and body. As the body ages or is affected by disease or dysfunction, it is impacted in such a way that it will never return to its former state of health 100%. Some effects are so damaging that they may leave a mark for life. The purpose of Chinese medicine is to remedy the cause and effects of these health challenges and balance the body and the mind. For example, if there is a worry causing too much heat in the stomach, this may cause reflux. So take a treatment that will cool it off. eat some ginger, eat some peppermint, and find some time to relax. Diagnosis, applying 5 elements in yin and yang. During the initial interview, the Chinese medicine practitioner gathers information from the patient about health history as well as current signs and symptoms. There are 4 main areas that are covered in making a diagnosis. The first is looking, noticing the physical body and its appearance. For example, pale skin can be a deficiency. Red skin can denote excess. Dry skin can denote a lack of fluids. He will also look at your tongue, the color, the shape, the coating. This is a correlation to the 5 elements. The tongue is divided into sections that also correlate to the organs, so that you can use it as a diagnostic to see if an organ is deficient or excess. Also, the practitioner will listen to your voice. And is it fatigued? If so, sometimes that can be weak or deficient. Is it loud or boisterous? Sometimes that can indicate too much yang and too much heat. He'll also ask you about smells. Smell of your urine, smell of your bowel movements. Often, odor from urine can designate heat. Questioning. A list of questions about past and present health, and it relates to the disease that you have at the current time. Sleep patterns. Are you sleeping through the night? Are you having trouble getting asleep, staying asleep, waking up? How is your digestion? Is it normal? Are you having daily bowel movements? Are you having any pain, and where is the pain? Many times the location of the pain will clue a practitioner into the treatment that needs to happen. What are your emotions around the current signs and symptoms? And does your lifestyle affect it, or has your lifestyle been affected by it? The practitioner then will touch the body, determine temperature. Is there moisture? Is there dryness? Is there pain upon touching, upon palpation? And where is that pain exactly? The practitioner will then take your pulses. There are 6 pulses on each wrist that denote disharmony in each of the organs. The right wrist contains the lung, large intestine, spleen and stomach, circulation and metabolism. The left wrist contains the heart, small intestine, liver, gallbladder, kidneys, and bladder. By checking the depth and strength of these pulses, the practitioner is allowed to make a diagnosis. Assessment and treatment. The practitioner will take into account the factors in a person's life that may affect their health. Internal causes, emotions, and constitutional factors like genetics. External causes. How are you affected by wind, cold, damp, heat, and dryness? And does that have an effect on the current signs and symptoms that you're experiencing? After the diagnosis, the practitioner forms a comprehensive treatment plan. The principles of yin and yang and 5 elements will be used to assess where there is excess or deficiency and which organ is in need of balance. A protocol of treatment is then prepared. There's a focus on prevention of disease that is at the heart of these therapies. The most known traditional prescription is acupuncture, followed by herbal formulas, exercise, and diet. Uses of acupuncture. Acupuncture promotes natural healing. It is used to enhance recuperative power and immunity by triggering the body to release chemicals that instigate healing and regeneration. It can support physical and emotional health by relieving stress and worry. It releases certain hormones and regulates certain brain processes. It is beneficial for overall function and well-being. It can be used as a maintenance plan to help keep you healthy over time. Acupuncture needles. The first acupuncture needles were sharpened stones and flint. Bamboo and animal bones were also used. Techniques to improve needle quality have been refined over millennia to produce very fine surgical steel needles in various gauges and lengths. Needles were sterilized and reused up until the 1980s. The use of the autoclave machine made the needles thin and break. This led to the development of the single-use filiform needle that is common today. These needles are sold in foil or paper-backed blister packs. A sharps box, a red box that sits on the desk at the doctor's office, is used to dispose of the needles. The companies that handle this service then incinerate them. Types of acupuncture needles. Most needles that are used are 1/2 inch to 1 inch. Needles are chosen by the point that is going to be needled. A point on the hip or leg may take a 1 inch needle, whereas a needle around the eye may take a 1/2 inch or smaller. It may be a thinner gauge or thickness. The plum blossom needle consists of a small hammer head on a flexible handle. It is usually made of plastic. Between 7 to 12 small sharp needles are used to gently tap the skin to stimulate the flow of blood underneath. This can be used for an area of the body that has an old trauma, injured tissue underneath the skin that has caused pain or stagnation in an area. Many people have a sprained ankle from years ago, have less range of motion over time. This type of needle will actually move the stagnant blood from the bruising and restore movement into the tissue. What can acupuncture treat? Acupuncture is good for pain and problems of the body in acute conditions, sprains, strains, pre and post surgery. Acupuncture is good for chronic and long-term problems of both excess and deficiency, IBS or irritable bowel syndrome, anxiety, depression, and hormonal issues. Used in conjunction with other treatments, herbal formulas, diet, exercise, and Tai Chi, acupuncture is looked at as a comprehensive form of medicine. There are some conditions like psoriasis or eczema that have an immediate response after treatment with acupuncture, but may require herbal medicine to have a lasting success. There are very few conditions that are contraindicated in acupuncture. Hemophilia, and in pregnancy, certain points related to delivery, for which acupuncture is effective when it is necessary, and also those that are mentally unstable. The treatment. What does it feel like? Patients in the United States are usually treated on a massage table or sitting in a chair. This is popular in community acupuncture clinics. At times, the front and back of the body will receive a treatment in a session. You'll treat on the back, take those needles out, turn the person over, treat them on the front. When a needle first enters the skin, you may feel a slight sting or a tingle to let you know the needle is in. After that, there should be no pain. You may know there's a needle in, but you should not be able to feel pain, achy, or sore. If so, ask the practitioner to reposition the needle or remove and reset the needle. Some patients are more sensitive than others, or their pain level may be higher or lower. The sensation of the needle should resolve within a few minutes. If not, ask your practitioner to move the needle. The patient will be lying on the table or sitting in a chair for 20 to 30 minutes on each side, depending if they're lying or sitting. Chinese medicine herbal formulas. Chinese herbal medicine and acupuncture are often used together in the treatment of disease and dysfunction. For more than 5,000 years, Chinese herbology has grown into an art all of its own. Each generation passed down a wealth of knowledge and experience so that today's practitioners can prescribe herbal formulas that have been gathered, formulated, and tested to provide a powerful therapeutic medicine. The herbs are classified using the same 5-element energetic yin-yang qualities and functions. This allows for a synergistic combination of precise herbs to treat each individual patient rather than a one-formula-fits-all approach. Herbal formulas can be prescribed in many forms: raw herbs to boil for a tea, liquid extracts, pills and capsules, which are most popular here in the United States, and powders to mix into water. Chinese herbal preparations. Here we see a doctor of Chinese medicine preparing a formula. The formula comes in raw herbs and are boiled to make a tea. The tea is usually consumed 3 to 4 times a day. Chinese herbs also come in powders that can be formulated into capsules and also into pills. Chinese herbal preparations also come in liquids so that you can take these under the tongue or in water or in hot water. Other treatment modalities. Cupping is a therapy designed to stimulate blood flow within the superficial layers of tissue. It treats skin to fascia to lymph to muscle. It can be used for sore muscles, neck and shoulder pain, low back pain, and the common cold by increasing humoral immunity. The modern treatment involves a suction cup placed on a specific area of the skin for 10 to 15 minutes to move blood and fluids underneath. A vacuum is created under the cup. The cup is pulling stagnant blood and inflammation and damaged cells to the lymph system to be flushed out of the body. The cups may leave a mark on the skin. This is different from a bruise, and this will dissipate within 2 to 3 days. Cupping tools and cup marks. The modern approach to cupping is using a handheld pump gun and plastic cups. The cups are placed on a wide area of the skin that needs moving, and once the cups are removed, they may leave a cup mark. These cup marks are not bruises. Bruises are actually a result from an impact to the skin and into the muscle. This is actually pulling stagnation and inflammation out of the tissue. Other treatment modalities. Tui Na. This is Chinese medical massage. The term means to push and grasp. It is used to break loose stagnation in the body's tissues. The hands work to release muscle pain, tension, and inflammation to heal injuries. Many times, this type of massage will result in a rocking or moving motion of the body back and forth. Moxibustion. This treatment uses the herb mugwort. It is dried and crushed and rolled into a cigar, and then it is burned over the skin. It never touches the skin, but it gets very close. This is used to warm acupuncture points and move the blood around them. This increases the rate at which the body heals by moving more fluid. Exercise. Tai Chi and Qigong are two of the most popular and well-known movements in Chinese medicine. They are easily learned and will provide health benefits throughout life if practiced regularly. Doing Tai Chi and Qigong daily is like giving yourself an acupuncture treatment on a daily basis. Chinese medicine overview. Chinese medicine can be used to heal and strengthen the body. It is used as support and can tonify the body when it is weak. It is a safe, effective, and painless way to treat a variety of medical problems. At times, these issues seem disconnected, but under the correlation of natural elements and the environment, there may be a pathway between unrelated signs and symptoms. The strength in treatment is identifying the underlying root cause of various medical conditions, whether acute or chronic. By addressing the mind, the body, and the spirit as a whole, Chinese medicine can not only restore health, but help to maintain a person's health throughout their lives. There are numerous books on the market and plenty of information online. Here are a few to get you started. Tom Williams, The Complete Illustrated Guide to Chinese Medicine. Raymond Bullock, Essential Traditional Chinese Medicine. Daniel Reed, The Complete Book of Chinese Health and Healing. And Giovanni Macchioccia, The Foundations of Chinese Medicine, which is actually the main text used for the National Certification of Acupuncture in Chinese Medicine. I hope you have enjoyed this lecture. Have a great day.